Thank you so much. So now to continue our framing and hear it from the really important perspective of two parents, we're going to first go to Jennifer Cullen, and then we will go to Eric Sandler.
Good morning. It is truly an honor to be here today, and I can't thank the sponsors of this meeting enough for hosting it. It's actually exactly 3 years ago today that my daughter was subjected to an MRI, which revealed an orange-sized mass behind her cerebellum. She would undergo a craniotomy, and that would reveal cells that showed a confirmation of a diagnosis of medulloblastoma with some evidence of anaplasia. And then began the most horrific conversations my life would ever know. Alexandra was only a few weeks shy of her 4th birthday, so she qualified for a very special clinical trial that would combine chemotherapy and a couple of biologic agents that were undergoing testing. This would allow us to delay radiation, which, as many of us know in this room, is critically important at such a young age, because the doses needed for cancer cure would be devastating to her cognitively and permanently. The worst horrors that her little body endured in the 13 months that she fought her cancer. She had a hole drilled into her skull to relieve intracranial pressure on that day of diagnosis. She had a permanent shunt placed in her scalp to control that pressure. She experienced sepsis when she was neutropenic. She had such extensive mouth sores that we had to do TPN through her Broviac catheter in her chest wall for several months before she died. The high-dose chemotherapy that she underwent in the final 3 cycles, one drug that was involved in those cycles is called Thiatipa, and as many of you know, it requires around-the-clock baths. Imagine waking up a 4-year-old at 2 a.m. and putting them in a shower so that you can wash off chemicals that can cause skin burns, chemical burns to her skin. And finally, ultimately, she had a seizure that led to blindness, muteness, complete incapacitation. Not long after that photo where she's standing in front of our Christmas tree. What were the worst horrors that we endured as her parents? The realization that she would die. Zipping up a white body bag, purchasing a pink coffin, and then having to carry on with life and raise a son. I attend many national cancer conferences because I'm a prostate cancer epidemiologist. I now also attend those meetings with the hat of a parent advocate for pediatric cancer. When I attend these meetings, there's a clear and important theme that we need to tailor therapies to the individual characteristics of a patient's tumor, recognizing that cancers are heterogeneous in their behavior. As an example of my own work, I presented in Madrid last fall. I performed a validation study of a 17-gene panel assay from a pharmaceutical company that successfully discriminates men who are fated for bad disease from men who are not, among a pool of men who all look good and favorable at diagnosis. What made that work possible was a national repository of clinically annotated biospecimens with long-term follow-up from racially diverse population. With the 3-year anniversary of Alexandra's death rapidly approaching in April, I'm fortified with a sense of hope and purpose and determination. The collective experiences of the families, and I'm staring at some of them in this room, need to matter. They need to not be in vain. And I think because of what we've gone through, there's an enormous determination among all of us that we will make this matter, that the cancer knowledge and delivery of care can improve and should improve, and that includes palliative care. The public health importance of childhood cancer is obviously not a function of the sheer volume of new cases that occur each year. It's a function of the high malignant potential of each of those cases, the devastating impact of treatment on the survivors, and the many years of life lost for each of those who don't survive. Thank you so much.